Learning about mechanical ventilation and mechanical ventilators can be extremely intimidating and confusing. But NCLEX loves to ask about ventilator alarms, so let's get into some of the most important things that you need to know about mechanical ventilation and mechanical ventilators. There is a lot to cover when it comes to ventilators. So there are modes, there are settings, there are different parameters that you are going to need to monitor. So I'm going to do a little mini series, and we're going to start by talking about the most common ventilator modes. Let's get into it. When it comes to ventilator modes, there are two broad categories that you need to understand. We have volume control modes and we have pressure control modes. With a volume control mode, the provider sets the amount of volume or the amount of air that's going to be pushed into the patient's lungs with each breath. So we have control over the volume. However, with volume control modes, the pressure is going to vary, and it's going to vary from patient to patient and from breath to breath. And that's very important to remember when you're thinking about volume control versus pressure control. With pressure control modes, we, or the provider, controls the amount of pressure that is pushed into the patient's lungs with each breath. So with a pressure control mode, the volume or the amount of air is going to vary from patient to patient and from breath to breath. Be sure to hit that follow button so you'll be updated for the next video in which I go into detail about volume control ventilation. Go Vols.